going to look at the inflammatory myopathy. So under the inflammatory myopathy, we are going to look at the types. So firstly, we are going to look at the types and we are going to look in detail of each of them. So first is the dermatomyositis. So there is the dermatomyositis. So dermatomyositis. Next comes the poliomyositis. Dermatomyositis. And then comes the polymyositis. Polymyositis. Then comes the inclusion myositis. Inclusion myositis. So we will look at all this in detail. So the first one we dealt was the dermatomyositis. So under the dermatomyositis, there is the age of onset. So what is this age of onset? So the age of onset here, it is from adulthood. The adulthood, or it is also present in the childhood. Next is the family association. The family association is that it is not present. Then when you look at the skin manifestation. So skin manifestation is yes, there is the skin manifestation is present. Next we will look at the muscle involvement. So what is this muscle involvement? So in case of the muscle involvement, there is symmetric. It is symmetric. Muscle involvement is that very symmetric. Then when you look at the histopath changes, there is the perimysial. There is perimysial. The perimysial CD4. Perimysial CD4 cellular infiltrates. As well as there is a perivascular infiltrates and the perivascular atrophy. Perivascular atrophy. So what about the association with the connective tissue diseases? So in terms of association with the CTD, that is connective tissue diseases, there is scleroderma. There is scleroderma and there is also mixed. There is mixed connective tissue only. Then when you look at the association with the other autoimmune diseases, AID, there it is infrequent. It is not frequent. And what about the association with malignancy? So association with the malignancy, the answer here is yes. Yes, there is association with the malignancy, and it is more commonly ovarian malignancy. Most commonly it is the ovarian malignancy. Next, we are going to look at the immunotherapy for this case. So under immunotherapy, it includes that it is responsive. The dermatomyositis is responsive. Next, we are going to look at the polymyositis. The polymyositis. So under the polymyositis, it is present in age. So the age group here is it is greater, that is greater than 18 months. It is greater than 18 years. And whether there is a family association, the answer is no, there is no family association. And when you look at the skin, whether there is skin manifestation, the answer here is no, there is no skin manifestation. Then we go ahead, we look at the histopathological findings. So what is this histopath findings? So here there is the endomysial. There is endomysial CD8 plus cellular infiltrates. CD8 plus cellular infiltrates, and there is perivascular infiltrates. Perivascular infiltrates, and this is with the amyloid inclusions, with the amyloid inclusions, and inclusion bodies. Then there is also amyloid inclusion bodies, as well as there is rimmed vacuoles. There is rimmed vacuoles. Next, we will look at the presence of associated connective tissue. So, is there an associated connective tissue? The answer is yes. And what about the autoimmune diseases? So, in terms of autoimmune diseases, is it frequent? The answer is yes, it is frequent. And what about the association with the malignancy? Association with malignancy, the answer is yes. So what does this mean? The association with malignancy, there is incidence much lesser than the dermatomyositis. So we can tell that the incidence is much lesser than the dermatomyositis. Now we will look at if the immunotherapy is responsive or not. So the immunotherapy, if you see, it is responsive. Next, lastly, we are going to look at the inclusion body myositis. The inclusion body myositis. So what is this inclusion body myositis? So here the age group is greater than 50 years, and the answer is there is a family association. The answer is yes, there is family association. This is the inclusion body myositis. And what about the skin manifestation? So when you're looking at the skin and the manifestation, the answer is no. The answer is no, there is no skin manifestation. And then when you look at the muscle involvement, so how is the muscle involvement? In muscle involvement here is asymmetric, whereas in other two cases it was symmetric. Here it is asymmetric. Then what about the histopath findings? The histopath findings, if you're seeing, it is the endomysial CD8, endomysial CD8 plus, endomysial CD8 plus, and there is cellular infiltrates. There is cellular infiltrates, and there is amyloid inclusion bodies. There is amyloid inclusion bodies. The amyloid inclusion bodies, and there is rimmed vacuoles. There is rimmed vacuoles. Next, we will look at the association of the connective tissue disease. The association with the connective tissue disease, the answer here is yes, there is association with the connective tissue disease. And what about the association with the other autoimmune diseases? The answer here is it is infrequent. It's not frequent. What about the malignancy? So in terms of malignancy, the answer here is there is no. That is, no malignancy is associated. So what about the immunotherapy? So answer for the immunotherapy is that it is resistant. So this was about the inflammatory myopathy, and we have dealt with the dermatomyositis, polymyositis, as well as the inclusion body myositis. Then we saw in detail about some aspects such as the skin manifestation, muscle involvement, histopath findings, and immunotherapy. So these are just to name a few. So to learn and grow daily like this, please do subscribe.